Izolami ngudisendidube oye Matobo Youth Development Initiative. So lamhlanje ngizakhuluma nge-state of access to information eMatobo District. Into ekhona ukuthi khona first of all iMatobo District ayila mainstream media. There is a limited reach of mainstream media. There are no radio stations cover iMatobo yonke. I can safely say ukuthi khona iMatobo North yodwa covered maybe national radio station is ZBC. So it's really hard, especially ngesikhathi se-pandemic, ukuthi khona sithole i-information, especially to the most vulnerable groups abasemakhaya. So sometimes athola khona i-adherence to ama-regulations awe-COVID-19 kusuka kube nzima because akula muntu oyabe le information right. So into ebanzima weekend, even the accessibility of information is fake news. There's too much fake news. Most of the people are accessing WhatsApp. So fake news is something which is circulating on WhatsApp, and that's what people appreciate more than factual information which can be got mainstream media.
Right, abantu abangomama eMatobo sihlukumezekile kakhulu ngendlela eziningi. Sikhangela ngendlela esehluleka ngayo ukuthola ulwazi ukubana sikwanise ukuzimela njengabomama, ikakhulu ngesikhathi lesi se-COVID-19. Omama abaningi behluleka khathesi as well speaking ukubana behlaba i-vaccine ngendaba zalapha abasukela khona. Behluleka ukubana bathole ukubana kahle kahle kumele benzeni ngobani okumele bayithole i-vaccine ngendaba zolwazi olungaqondile labe lifike ebantwini. Right, thina sisebenzisa i-platform ikakhulu enjenge WhatsApp. Sikwanisa ukusebenzisa i-platform ikakhulu enjenge community magazine esilayo as iMatobo Youth Development Initiative. Sibhala ikakhulu ngezinto omama kumele bazazi, ngezinto kumele zenzakale ukubana bekwanisa ukwenza lokho abafisa ukukwenza. Right, as omama beMatobo sibala ama-challenges ukuthi masifuna ukuya vaccinate ezibhedlela zikhatshana and akula ma-mobile clinics right now okubana sikwanisa ukuyafika kuwo, sikwanisa ukuthola i-vaccine. As omama sikhathazekile ngendlela eziningi ngoba ulwazi esilutholayo kayisilo. Wesikhathi ezwa sokuthiwa omama kumelanga bahlabe, omama abanje abahlabe, omama abanje abahlabi. Sese singasakwazi loba basifuna ukuyahlaba, sese singasakwazi ukuthi are we in the right position yini as women to go and get that vaccine, or do we have that right as women to get that vaccine? Ikanti if we continue, or if we get help from other people, like sincediswa i-RDC, sincediswa ngabe health, ukubana sikwanisa ukufinyelelisa ulwazi ebantwini, kungaba into enhle kakhulu ukubana omama labo bakwanisa ukufinyelela. Kanti singathola ama-mobile clinics kungaba kuhle kakhulu ukubana omama labo bakwanisa ukufinyelela ukuyahlaba i-COVID-19.
So kuba nzima kakhulu. So what has been happening ukuthi khona lathi as a community-based organization we've been trying to engage ama-stakeholders on accessibility of information. We've been writing ama-requests to RDC to ensure ukuthi people are able to access information, especially during isikhathi se-COVID, because it has affected some offices amaningi. There's no operation of amanye ama-offices. So the feedback was positive from the RDC. We managed to have ukuthi khona they make themselves available ukuthi khona sibanike space to our community magazine which is circulating monthly. So we are communicating even with the RDC CEO and the DTC office. We are having a progressive relationship with the authorities to try and disseminate information to the most vulnerable communities. So requests are uwenza. So into khona ukuthi khona the mainstream media doesn't reach Matobo, so a lot can be done by government, or even when they bring information, ibuye ngevernacular, ibuye ngesindebele, ibuye ngesikhalanga, because these are the languages for our community. So into esiyifisa ukuthi khona ngabe yenzakala. But what we can say ukuthi khona kwesilako as a community, as a collective, we are trying to ensure ukuthi khona we reach out to as many communities as possible to debunk fake news ekhona. That's what I can say with the state of information during the COVID-19 pandemic and the request of information which we have been doing as a community-based organization.